interesting times. Today's stories. A statement from the World Health Organization leaves Canadians confused. Canada delivers support for provincial pandemic vaccines and healthcare campaigns. Filipino workers arrive in the French-speaking province of Quebec. Crane collapses at Western Canadian construction site, claiming 4 lives with a 5th person presumed dead. An update on the reopening of the Canadian-US border. Hello everyone, you are watching Eagle News Canada. I am Kathleen Cruz from Vancouver, British Columbia, bringing you stories from across the globe. Is it safe to mix the vaccines? The question that Canadians continue to ask as vaccinations continue to roll out. Eagle News correspondent Sherry Colizado has the story.
Earlier this week, a statement from the World Health Organization confused many Canadians as to whether or not it is safe to mix vaccines. Here's the statement.
There is limited data on mix and match. There are studies going on. We need to wait for that, and maybe it will be a very good approach. But at the moment, we only have data on the AZ vaccine, Oxford AstraZeneca, followed by Pfizer.
Canada has been following NACI's recommendations to mix mRNA vaccines when the same mRNA vaccine product is not readily available. This statement from the WHO was published in several Canadian media websites, with some quoting the WHO saying that this was a dangerous trend, leading to some panic responses from those who have already taken a different vaccine for their second dose, and increased hesitancy from those who have yet to take their second dose. This has prompted an immediate response from some known Toronto doctors, one of them, infectious diseases physician and scientist, Dr. Isaac Bogosh. We see data from the UK, Spain, and Germany demonstrating that mixing vaccines in the manner we're doing in Canada is safe and provides a significant or robust immune response. To help clarify things, Dr. Samya Swaminathan, WHO's chief scientist who made the statement, posted that individuals should not decide for themselves. Public health agencies can, based on available data. Data from mix and match studies of different vaccines are awaited. Immunogenicity and safety both need to be evaluated. Here are some responses collected in regards to this issue.
In terms of the WHO statement, I do agree with the scientists to some extent. It's true that there is limited scientific research behind mixing vaccines. However, a lot of people are taking it out of context and not really understanding what they actually meant. In terms of Canadian doctors, I think right now they're looking at the short-term effects. Right now, people have been mixing and there's no bad effects. However, I know they're doing long-term research to see that.
We just have to be aware or beware of health misinformation that are often being posted on social media. It is recommended for us to speak with health professionals for facts and for them to listen to our concern.
Dr. Eileen Davila, Toronto's Medical Officer of Health, further clarified in a press conference that Dr. Swaminathan's statement was simply taken out of context.
There has been some confusion following comments on Monday by an official of the World Health Organization. She was responding to a question about the need for future booster shots. Since then, her answer is sometimes being repeated as if she was talking about the mixing and matching of first and second doses. She was not. She was describing what would happen if people decided to try to get a booster on their own and did not rely on medical advice.
In addition, Dr. De Villa reassures the public of the safety of mixing vaccines.
I myself received Pfizer for my first dose and Moderna for my second, and I can assure you that I am very comfortable that I am protected. The best vaccine is the vaccine you can get, and we're fortunate that there are lots of options now on where to get your vaccine.
As the city continues to see a decrease in new COVID-19 cases and works hard to increase its vaccination rates, the message remains the same: to get fully vaccinated as soon as possible. In Toronto, Cherry Recolisado, Eagle News. We live in interesting times.
The Canadian government delivers $5 billion in pandemic support to provinces and territories for vaccines and healthcare. Eagle News correspondent Andre Lajoie reports.
Today, the Honorable Chrystia Freeland, Deputy Prime Minister and Minister of Finance, announced the payment of $5 billion to provinces and territories, distributed equally per capita to further support vaccinations campaign and assure the healthcare system remains resilient and responsive to Canadian needs. The Government of Canada is providing $4 billion through a one-time top-up to Canada Health Transfer to help address the extreme pressure that COVID-19 has put on our healthcare system. This funding will help provinces and territories address immediate health system pressure, including clearing backlog medical procedures, patient care, and access to primary care, put on hold due to the pandemic. In addition, the Government of Canada is providing $1 billion to support vaccine rollout campaign across the country and helping Canadians receive their first and second dose as quickly as possible. The funding supports a variety of vaccine-related costs such as recruiting and training, establishing mass vaccinations clinic, setting up mobile vaccinations units, engaging Indigenous communities to advance vaccines rollout, and reaching the vulnerable populations through the community-based vaccinations effort. Fighting the COVID-19 pandemic has been a Team Canada effort. This investment in all provinces and territories will help us to finish the fight against COVID-19 and assure the Canadians are able to receive the care they need and deserve as we move forward to the brighter days ahead, says the Honorable Chrystia Freeland, Deputy Prime Minister and Minister of Finance. The COVID-19 pandemic has highlighted why we need to invest in our healthcare system. The Honorable Patty Ledoux, Minister of Health, says that every step of the way, we've worked to protect Canadians so that when they need support, it's there for them. This top-up to the Canada Health Transfer will support provinces and territories in their duties to deliver care for Canadians through this pandemic and beyond, says the Honorable Patty Ledoux, Minister of Health. To date, more than 8 out of every $10 to fight the pandemic has been provided by the Government of Canada. Reporting from Ottawa, Canada, this is Andre Lajoie. We live in interesting times.
A fast food restaurant in the town of Setil welcomes 4 new Filipino workers. Eagle News correspondent Marjorie Quintos with the story.
Overseas workers from the Philippines, Jamie Singson, Jerome Maron, Jessilu Ebo, and Quazen Cruz arrived in the town of Setil in Quebec last week to work for a fast food restaurant. They were welcomed by Filipinos who have been living in this part of Quebec, where population is less than 26,000 and majority of residents are French speakers. They applied for their work visas during pandemic in July 2020. As a result, their visa applications took almost 1 year to process. On a good note, the group had the chance to take French lessons before receiving their work visas. Their employer, Marie-José Carrier, is pleased to have these 4 new team members with a statement.
Well, I'm so excited because Jamie, Jerome, Kaizen, and Jessilu just arrived in Setil last week to work in our restaurant, A&W restaurant, and I'm really excited because we've been waiting such a long time for these people to arrive. in Canada, and back in the Philippines, they were starting to learn French, which is much more easier for us because when they come here, they can talk already in French with their work colleagues. So this is really appreciated from the locals here. But we're so excited because everyone so far is healthy, and that's the most important. Everyone is safe and sound, so we're so excited.
Reporting from Montreal, Quebec, Marjorie Quintos, Eagle News. We live in interesting times.
Police in a Western Canadian city of Kelowna say 4 construction workers died in a crane collapse and a 5th man is missing but presumed dead. Eagle News correspondent Stacey De Ocampo with more details.
Police in the Western Canadian city of Kelowna say that 4 construction workers died in a crane collapse and a 5th man is missing and presumed dead. Unfortunately, 4 individuals, all male adults, were located at the scene and had died as a result of the injuries from the crane having collapsed. Police Inspector Adam McIntosh said, "A 5th man, who was in an adjacent building when the crane collapsed on it, is buried in the rubble and believed to be dead." "Yesterday was a tragic day," said McIntosh. "To see all those workers standing there, knowing they had just lost some of their friends and co-workers, and to see the families and what they were dealing with, I can only imagine what they're going through." The crane was attached to a 25-story residential building under construction when it collapsed. At the time, crews were trying to dismantle it. McIntosh says an evacuation order remains in effect while structural engineers will determine how to stabilize the site. Among those forced from their homes were residents of a nearby seniors' home. That building sustained damage to the roof when the crane fell on it. Cause of the collapse remains under investigation. In Montreal, Stacey De Ocampo will live in interesting times.
What does the easing of COVID-19 restriction across the country mean in terms of the Canadian-US border? Eagle News correspondent Vanessa Condy with the details.
As a percentage of people who are fully vaccinated are increasing in Canada, and the easing of COVID restrictions, the Tourism Industry Association of Canada are calling for the government to open borders to fully vaccinated travellers. The Prime Minister had the 33rd call with premiers this week on COVID-19 response. The Prime Minister mentioned, "If our current positive path of vaccination rate and public health conditions continue, and with the ongoing discussions with the United States on reopening plans, for fully vaccinated US citizens and permanent residents," he indicated that we could expect to start allowing them into Canada as of mid-August for non-essential travel. The Prime Minister also noted, with a positive trajectory of vaccines and low COVID cases, Canada would be in a position to welcome fully vaccinated travellers from all countries by early September. This will be welcomed for many families that have been apart due to the COVID-19 restrictions, and for the travel industry that has been hit hard due to the pandemic. However, there needs to be caution with the new variant spreading. In Victoria, BC, Vanessa Condy, Eagle News, we live in interesting times.
Coming up, we have updates from the Canadian Elite Basketball League and the NBA. Eagle News Canada continues after this.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
Ang trabaho naman talaga ng maritime group ng PNP is to enforce the maritime
Tayo
laws.
lang yung stricto, pero in other parts of the country, pwede na naman ang tourism.
Definitely, we are ready to respond to a possible spike.
Sapagkat ang aming intensyon ay makatulong lang sa mga tao na wala talagang magamit na gamot.
92 voted for this resolution, which will make it stronger, calling on the Justice Department to come up with more stringent ways to be able to avert these hate crimes against Asian Americans.
Mas marami po tayong magagamit ngayon na mga tools or mga equipment.
Maraming salamat, Weng, at sa buong puwersa ng Balitalakayan sa pagkakataong ito.
Tatalakayin ang mga pangunahing balita live sa teleradyo ng Net25 at Radyo Aguila DCEC 1062. Kasama si Weng de la Fuente sa Balitalakayan.
We live in interesting times.
Welcome back. You are watching Eagle News Canada. I am Kathleen Cruz from Vancouver, British Columbia. For the first time in over a year, sports fans in British Columbia have been allowed back into sporting events. The Fraser Valley Bandits of the Canadian Elite Basketball League became the first professional team in the province to welcome fans back into the stands since the COVID-19 pandemic. Here's Eagle News correspondent Anthony Sevilla with more details from the Abbotsford Centre.
After almost a year and a half without fans in arenas, the Fraser Valley Bandits became the first professional team in British Columbia to welcome fans back into the stands.
Despite the limited maximum capacity, the 1,900 fans who attended played a solid role in Fraser Valley's 92-71 win over Guelph to maintain their perfect home record. Malcolm Duvivier led the Bandits in scoring with 20 points off the bench on 7 from 10 shooting from the field. Kenny Manigo also added 14 points and 6 assists. The Bandits mentioned how great it felt to play in front of fans for the first time in almost 2 years.
Yeah, it was awesome. I mean, it's been a year plus for everybody involved in this situation, and we couldn't be more happier with the fans here. They gave us a lot of energy tonight. I think we fed off of them a lot of parts in the game, and we're just so happy to have them back, and that support really lifts us throughout the game. It's great, man. You kind of forget that you're able to play in front of people because we've done it so long. I mean, I've coached 2 seasons now with no crowd, so it's been, it's a delight to see that, and I know the guys were really happy, and I know they thanked the fans after, and we really appreciate their support, and so I'm hoping it doesn't change, and I'm hoping they can keep coming for the rest of the way.
Fans brought a lot of energy for us, and we were able just to feed off their energy and got the win. It feels great. You can't even put it into words how good it feels.
Feels amazing. Like after being almost 2 years without playing in front of fans, it's just been. It will just give you that extra edge, the extra push on the defensive end, and just make you want to give that. Just dive on the floor, just make that extra little play, just because I know that's what the fans come out here and they love to see, right? Especially being Abbey, good working town, they love seeing us working hard, so it just gives you that extra motivation to go out there and play hard.
After starting the season with a 5-0 record, the Bandits returned home from a week-long road trip that resulted in back-to-back losses for the first time this season. Their defensive identity was a huge factor in their 5-0 start to the season, and the Bandits knew they needed to shift their focus back on the defensive end. Their efforts paid off as they led in rebounds, assists, and in steals against Guelph.
We lost the last 2 games. The whole week this week, or the last 2 practices, we just was working on defense. That's our identity. So, we were just hungry to come out and get a win in front of the fans.
I think just losing those 2 games on the road, it really got under our skin because we knew it was all us. Like those 2 losses we took, we didn't come out with the fire that we needed. So
coach really, lit that fire today and the last 2 days in practice, and we just came out here with something to prove, right? So we know that even though we started out 4-0, that we're still the underdogs. There's still teams that don't believe us, don't believe that we're even after making it to the championship last year. So every single game we come out here, we have something to prove, and yeah, we just leave it on the court. We wanted to give the fans, something, a good game to come back to.
In Abbotsford, British Columbia, Anthony Sevilla, Eagle News. We live in interesting times.
In other sports news, we have highlights from the WNBA All-Star Game, NBA Finals, and the countdown to the Summer Olympics in Tokyo. Here's Eagle News correspondent Tenny Sumage with details.
For the first time in league history, the WNBA All-Star Game was held during an Olympic calendar year. The format was quite different, with Sue Bird, Diana Taurasi, and some of the league's selected players to play in Tokyo played against some of the best players in the league. Team WNBA defeated Team USA 93-85 behind Dallas Wings guard Arike Owumeke's 26 points and was selected as most valuable player.
It's dope. I mean, I scored a little bit early, and then teammates like them, nobody suffers on the team, so they gonna feed whoever's hot. JJ was knocking shots down, we feeding whoever was hot. So it just turned out I scored a little bit more points, but she a little MVP too, so whatever.
The Milwaukee Bucks defense has been dominant for the past 2 games. And with the series heading back to Phoenix, tied at 2 games apiece, the Suns hope that fans will help their team get back to a winning momentum.
It's been a great momentum to have our fans in our building. We felt that right when we started to bring fans in the building during the regular season. We felt the support. So it's great to be home and have our city behind us, have our fans behind us. We definitely feel it as a team, as an organization. We feel it. We feel the cheers from our fans. Not even in the arena, just outside of the arena, outside the city. You feel the support that we have throughout the city. So it's great to come back home and play the next game in front of our home crowd.
Lastly, with the Olympics underway within a week, IOC President Thomas Bach reveals some of the plans that will occur during the opening of the Summer Games.
Can be now 8 days from the opening ceremony is thanks to the efforts of so many, but in particular of the people of Tokyo and the many unsung heroes from Tokyo, the medical people, the nurses, and so many others, but also all the people of Tokyo who are respecting the strict rules which have been established here and in order to contain the virus.
And that's a wrap for this week's sports news. In New York, Tenny Sumagi, Eagle News, we live in interesting times.
Scientists and enthusiasts continue to monitor a high-speed solar flare that possibly caused a communication disruption in some parts of the world. Eagle News correspondent Ron Hamilton from our Hawaii Pacific Bureau explains more about the phenomenon.
Most of us who use mobile devices will need to be patient in the next day or two, as a solar flare is due to hit the Earth and is expected to disrupt both cellular and radio signals. NASA's Solar Dynamics Observatory captured this latest event and was immediately classified as an X-class eruption, the most powerful type of solar flare. This latest phenomenon is the biggest of its kind since 2017, when an X 8.2 event was recorded. Solar flares are large eruptions of electromagnetic radiation from the sun, lasting from minutes to hours. The sudden outburst of electromagnetic energy travels at the speed of light, Therefore, any effect upon the sunlit side of the Earth's exposed outer atmosphere occurs at the same exact time if the event is observed. The increased level of X-ray and extreme ultraviolet radiation results in ionization in the lower layers of the ionosphere on the sunlit side of the Earth, causing high-frequency radio signals to become degraded or completely absorbed. This results in a radio blackout, the absence of HF communication, primarily impacting the 3 to 30 megahertz band. Solar flares usually take place in active regions, which are areas of the sun marked by the presence of strong magnetic fields, typically associated with sunspot groups. Reporting from Honolulu, Hawaii, this is Ron Hamilton with Eagle News. We live in interesting times.
That's today's Eagle News Canada. Join us again next week as we bring stories that matter to you. Visit our website at eaglenews.net and eaglenewslive.com. Follow us on Twitter at twitter.com/eaglenews and on Facebook at facebook.com/eaglenews. Thank you for watching. I am Kathleen Cruz. We live in interesting times.
Factual.
We have to defeat the virus everywhere.
Timely information. Balanced. Not only in the country,